Welcome to my channel. If you are new, please hit the subscribe button, like, share, and hit the notification bell for updates of my new video. Preoperative phase. The goals for this phase are assessing and correcting physiologic and psychologic problems that may increase surgical risk, giving the person and significant others complete learning and teaching guidelines regarding surgery, instructing and demonstrating exercises that will benefit the person during post-operative period, planning and for discharge and any projected changes in lifestyle due to surgery. Physiologic assessment of the client undergoing surgery. Presence of pain, nutritional and fluid and electrolyte balance, cardiovascular and pulmonary function, renal function, gastrointestinal and liver function, endocrine function, neurologic function, hematologic function, use of medication, presence of trauma and infection. This assessment should be done by the nurse before sending the patient to the operating room. Routine preoperative screening test, CBC. Complete blood count, red blood cell, hemoglobin, hematocrit, are important to the oxygen carrying capacity of blood. White blood cell are indicator of immune function. These are important components to know if the client is having a normal or abnormal value during CBC testing. Blood grouping and cross-matching. This should be determined in case blood transfusion is required during or after surgery. Serum electrolyte. To evaluate fluid and electrolyte status. Prothrombin time and partial prothrombin time. Measure time required for clotting to occur. This is to prevent bleeding and blood loss during and after surgery. Fasting blood glucose or fasting blood sugar. Blood specimen should be drawn after fasting for 8 hours. High level may indicate undiagnosed diabetes mellitus. This is crucial for wound healing. Blood urea nitrogen and creatinine. To evaluate renal function. This is crucial for the excretion of medicines the patient may take before and after surgery. ALT, AST, LDH and bilirubin. Evaluate liver function. Liver function should be functioning normally, to metabolize the medicines the patient may take during or after surgery. Serum albumin and total carbon, hydrogen, oxygen, nitrogen. Important to evaluate nutritional status of the patient. Albumin is a protein made by the liver, so normal liver function is important. Urinalysis. Determine urine composition. Normal chemical composition of urine, urea 9.3 grams per liter, chloride 1.87 grams per liter, sodium 1.17 grams per liter, potassium 0.750 grams per liter, creatinine 0.670 grams per liter, and other dissolved ions. Chest X-ray. Evaluate respiratory status and heart size. It is important that the patient will have a normal result, to secure the cardiopulmonary clearance to be signed in order to proceed with the surgery. Electrocardiogram. This will identify pre-existing cardiac problem. All of this routine and screening test should be assessed and done preoperatively. Psychosocial assessment and care. Fear of unknown, anxiety. Fear of anesthesia. Fear of pain. Fear of death. Fear of disturbance on body image. Example: loss of limbs, loss of breasts and other outcome after surgery. Worries. Loss of finances, employment, social, and family. Signs and symptoms of fears. Anxiousness, bewilderment or puzzlement, anger, tendency to exaggerate, sad, evasive, tearful, clinging, inability to concentrate, short attention span, failure to carry out simple directions, dazed, very confused and unable to think clearly. Nursing intervention to minimize anxiety. Explore client's feeling by using an open-ended questions. Allow client to speak openly about fears and concern with regards to the upcoming surgical procedure. Give accurate information regarding surgery, in brief, direct to the point and in simple terms. Give empathetic support. Consider the person's religious preference and arrange for visit by a priest or minister as desired. With these interventions, patient's anxiety may alleviate. But make sure that you are actively listening when the patient is talking. Let us discuss the informed consent and why is it necessary. Purposes of informed consent. 1. to ensure that the client understand the nature of the treatment including the potential complications and disfigurement. This will be explained by the surgeon. 2. To indicate that the client's decision was made without pressure. 3. To protect the client against an authorized procedure. 4. To protect the surgeon and hospital against legal action by a client who claims that an authorized procedure was performed. Circumstances that will require informed consent. 1. Any surgical procedure where scalpel, scissors, suture, hemostats, of electrocoagulation may be used. 2. Radiologic procedures, particularly if a contrast material is required. 3. General anesthesia, local infiltration, and regional block. In summary, all invasive procedures need an informed consent legally signed by the patient, or if client is a minor, parents or guardians may sign the informed consent. Essential elements of informed consent. 1. The diagnoses and explanation of the condition. The attending surgeon should explain the procedure. 2. A fair explanation of the procedure to be done, and used and the consequences. Surgeon will explain. The role of the nurse is to reinforce the knowledge of the client in case he or she is confused. 3. A description of the benefits to be expected after the surgery. 4. The prognosis, if the recommended care, procedure is refused. Be factual, do not give false reassurance to the client. Requisites for validity of informed consent. 1. Written permission is best and legally accepted. 2. Signature is obtained with the client's complete understanding of what to occur. For adult client, they must sign their own operative permit. This permit should be obtained before the client is sedated. For minors, parents or someone standing on their behalf gives the consent. Note: for a married emancipated minor, parental consent is not needed anymore, spouse is accepted. Let us continue. For mentally ill and unconscious patient, consent must be taken from the parents or legal guardian. If the patient is unable to write, an X is accepted if there is a witness to his mark. Secured without pressure and threat. A witness is desirable. Nurse, physician or authorized persons. When an emergency situation exists, no consent is necessary because inaction at such time may cause greater injury. Permission via telephone or cell phone is accepted, but must be signed within 24 hours. Preoperative care. Physical preparation. Before surgery. Correct any dietary deficiencies. Reduce an obese person's weight. Correct fluid and electrolyte imbalances. Restore adequate blood volume with blood transfusion. Treat any chronic diseases. Halt or treat any infectious process. Treat an alcoholic person with vitamins. Supplementation, intravenous fluids if dehydrated. Preoperative teaching. Teach the clients about the following procedures. Incentive spirometer. Diaphragmatic breathing. Coughing. Splinting. Turning to sides. Foot and leg exercise. Early ambulation. Preparing the patient the evening before surgery. Preparing the skin. Advise client to have a full bath if tolerated to reduce microorganisms in the skin. Hair should be removed within 1 to 2 millimeters of the skin to avoid skin breakdown. Use of electric clipper is preferable. Preparing the gastrointestinal tract. Client should be on nothing per orum, and cleansing enema as required. Preparing for anesthesia. Avoid alcohol and cigarette smoking for at least 24 hours before surgery. Promoting rest and sleep. Administer sedatives as ordered. Preparing the patient on the day of surgery. Awaken the patient 1 hour before giving preoperative meds. Do morning bath and mouthwash. Provide a clean gown. Remove hairpins. Braid long hair. Cover hair with cap if available. Remove dentures, colored nail polish, hearing aid, contact lenses, and jewelries. Take baseline vital sign before giving preoperative medications. Let us continue on the day of surgery. Check identification band. Prepare the skin. Check for special orders, like enema, intravenous line. Check for nothing per orum orders if it is followed. Ask the client. Have the client void before giving the preoperative medications. Continue to support emotionally. Finally, accomplished preoperative checklist, according to your healthcare facility. Preoperative medications and its goals. To aid in the administration anesthetics. To minimize respiratory tract secretion and changes in heart rate. To relax the patient and reduce anxiety. What are the commonly used preoperative medications? Tranquilizers, analgesics, anticholinergics, proton pump inhibitors. After completing the checklist, client is now ready for transport to the operating room. Follow the following protocols. Adhere to the principle of maintaining the comfort and safety of the client. Accompany operating room attendants to the client's bedside for introduction and proper identification. Assist in transferring the patient from bed to stretcher. Make sure that the patient arrive in the operating room at the proper time. Patient's family or significant others. Things to be done. Direct family members to the proper waiting room. Tell the family that the surgeon will probably contact them immediately after the surgery. Explain reasons for long interval of waiting. This may be because of the preparation that may occur inside the operating room, like preparation and induction of anesthesia, skin preparation on the surgical site, surgical procedure. Some are long and some are short, then for the patient stay at the recovery room. Tell the family what to expect postoperatively when they see the client. This is depending on the surgical procedure. Thank you for watching. If you want to study nursing anywhere, please subscribe, like, share, and click the notification bell for updates of my new video. If any concerns, just comment below.